Welcome to this week's edition of Senior Talks, an exciting new educational program for those aged 45 and older in the Harris County area. Senior Talks features various presentations on opioid use, medication management, recovery, and overall health. Senior Talks is sponsored by the Harris County Area Agency on Aging and the Elderly Program through the Council on Recovery. Today, we have Leah Bell, older adult peer recovery specialist, here to share with us some information on pain management. Take it away, Leah.
Thank you. Today's segment is on pain management. In part one of pain management, we will discuss the impact pain has on the lives of the older adult population, the barriers that may prevent older adults from receiving accurate pain management care, and the 4 types of pain people experience. My hope is that after this segment, you will be equipped with the correct verbiage and terminology needed to describe feelings and symptoms you may experience as it relates to your pain. It is my hope that this will help you better communicate those indicators to your doctor, your loved ones, and caregivers, so they may be better able to support you in your pain management. Okay, today's pain and pain management are a growing concern amongst Americans age 65 and older. Chronic pain amongst this population is now at an epidemic proportion. And the overprescribing of pain medication and undertreatment of pain management isn't helping. In fact, the impact of overprescribing has led to a national opioid crisis amongst the older adult population. Opioid-related hospitalization in older adults age 65 and over has increased by 34%, and emergency room visits increased by 74%. Though some of these visits are also due to the unique challenges of pain management for the older adult. Now, aside from misuse, other serious risks of opioids are pronounced on the older adult, even at doses considered to be therapeutic and appropriate. The high-risk factors associated with opioid use in older adults include multiple medications resulting in drug-to-drug interaction, compromised respiration, cognitive impairment, altered hepatic and renal metabolism, which simply means the drug is accumulated in the liver, and doesn't pass through the urine from the kidney, and ultimately death. Statistical data provided by the National Institute of Health found that more than half, that's 53% of older adults interviewed reported living with pain, and a quarter of them reported experiencing pain in more than one location in their bodies. Now, we just discussed that overprescribing of medication is problematic, but contrarily, undertreatment is also an issue for some. Pain in the absence of disease is not a normal part of aging, yet it is experienced daily by most older adults in the United States. Unfortunately, the absence of disease creates barriers for treatment, which result in high risk of undertreatment and of pain management in older adults. The barriers often stem from 3 different sources. The first source is that of the healthcare professional. The second source is cost, and the third source is patient-related barriers. So what are these barriers? Well, The barriers that stem from the healthcare professional are due to lack of education regarding pain assessment and management. The healthcare professional may fail to recognize the pain to be chronic or persistent. The healthcare provider may believe that adults feel or experience less pain. And lastly, the healthcare provider may believe in fatalism, which is the belief that pain is part of the aging process. When it comes to the second source of barriers, it is the cost and other obstacles related with the healthcare system. So that is another barrier. The healthcare systems may get in the way of treatment of pain management in older adults. Finally, the third source of pain-related barriers are those barriers typically stems from the patient being reluctant to report their pain. The older adult may not want to report pain because they feel it is normal when you're getting older. They feel by discussing their pain, they may be seen as a bad patient. They may they may fear more medication and its adverse side effects. And they may be concerned about addiction. Also, some older adults may have a value of stoicism, which is the belief that endurance of pain and hardship is to be experienced without display of feelings or complaints. Please, if you are experiencing any kind of pain whatsoever, let your doctor know. Please don't suffer in silence. Another patient-related barrier may be communication problems due to cognitive impairment, dementia, or difficulties with accurately explaining their pain to another. So now let's transition into the 4 types of pain and their descriptive words of each of those pain types. But first, let's clarify what pain is. Webster's definition of pain is a localized or generalized unpleasant bodily sensation or complex sensation that causes mild to severe physical discomfort and emotional distress. It typically results from bodily disorders such as an injury or disease. The nature of pain is subjective and highly personalized. Its stimulus is physical and or emotional in nature. It interferes with personal relationships and influences the meaning of life for many. Only the patient knows whether pain is present and how the experience feels. Pain may not be directly proportionate to the amount of tissue damage, which simply means that 2 individuals can have the same exact type of injury. However, one may experience it on a scale from the discomfort on a scale from 1 to 10 as a 5, whereas the other individual with the same exact pain, the same exact injury may say it's an 8. Okay, so there are the 4 types of pains. They are classified, their classification is based on endurance, location, intensity, and the cause. The first type of pain is acute pain, which only lasts through the expected recovery period, which means the time it is expected to take to heal. Acute pain is protective, has an identifiable cause, is short in duration, and has limited tissue damage and emotional response, and can eventually be resolved with or without treatment. However, there are some cases where unresolved or unrelieved chronic pain can progress and lead to chronic pain. Chronic pain, which brings us to chronic pain, which is the second type of pain. Chronic pain is the pain that lasts more than 6 months and is constant or recurring with a mild or severe intensity on any given day. It is fairly common, affecting an estimate of 50 million adults in the United States. It doesn't always have an identifiable source and can lead to great personal suffering. Other symptoms that may accompany chronic pain is tense muscles, lack of energy, and limited mobility, just to name a few. Common examples of chronic pain is frequent headaches, migraines, nerve pain, lower back pain, arthritis pain, and fibromyalgia, which is pain in the muscles and bones. The possible unknown cause of chronic pain and the uncertainty of the duration can be very frustrating for the older adult, frequently leading to psychological depression and sometimes suicidal ideation or suicide. Associated symptoms are fatigue, insomnia, weight loss. The third type of pain is called nocceptic pain. What a word, nocceptic pain. This is the most common type of pain. It is experienced when an intact, properly functioning nervous system sends signals to the brain that the tissues are damaged, requiring attention and proper care. For example, the pain you experience following a cut or broken bone alerts you to avoid further damage. Once healed, the pain goes away. Nocceptic pain can further be classified as somatic pain or visceral pain. Somatic pain is felt in the skin, muscles, bones, and connective tissues. It is often easier to pinpoint the location of somatic pain rather than visceral pain. Somatic pain can be further classified as superficial or deep, or feels like a constant ache or gnawing. The sharp sensation of a paper cut or the aching of a sprained ankle are common examples of somatic pain. Examples of somatic pain include bone fractures, sprained muscles, connective tissue disorders such as osteoporosis, cancers that affect the skin and bone, and skin cuts, scrapes, and burns. Visceral pain is felt in the cavity of the chest, the pelvic, and the abdominal organs. Visceral pain is usually hard to pinpoint the exact location of pain and is described as pressure, pressing, aching, squeezing, cramping, or throbbing. You may also notice other symptoms such as nausea and vomiting, changes in your body temperature, heart rate, and blood pressure. Example of these causes for visceral pain is gallstones, appendicitis, and irritable bowel syndrome. So somatic pain deals with outside the body, or the tissue, the bones, the connective tissues, whereas the visceral pain is experienced in the organs. And the fourth type of pain is neuroplastic. That's another word, huh? Neuropathic pain, which results from a damaged or malfunctioning nervous system. This results in damage or dysfunctional misfiring of pain signals which seem to come out of nowhere, rather than a response to a specific injury. You may also feel pain in response to things that aren't usually painful, such as cold air or clothing against your skin. Neuropathic pain is described as burning, freezing, numbness, tingling, shooting, and stabbing. Diabetes is a common cause for neuropathic pain. Other sources of nerve injury or dysfunction include chronic alcohol consumption, accidents, such as car or fall, etc., shingles, carpal tunnel syndrome, Parkinson's disease, and multiple sclerosis. So now that we see the impact pain has on the older adult population, the barriers that prevent appropriate management care, and the devastating effects of overprescribing of opioids to the nation and its high risk of harm in the older adult, even at low dosages. So in part 2 of pain management, we will seek solutions to this growing problem. If you or someone you know need help, please call the number provided on the screen.